Speech pathology is the study of speech, language and communication problems of a varied nature. Generally, a speech pathologist would work with people who have problems with their voice or stuttering or generating language, sometimes problems because of a hearing problem or an intellectual problem. They may have problems because of a car accident. They may have coordination problems because they're born with problems controlling their motor muscles and motor movement, and they might have problems swallowing. So a huge range of issues. Also, perhaps people who have problems learning, children who don't have enough language to learn well at school. It's a very wide profession with a huge range of options. In the speech pathology course at La Trobe, we have two campuses, one in Melbourne and one in Bendigo, and the students do the same program. They do a common first year, trying to get an understanding of interdisciplinary and multidisciplinary practices, what happens in various areas of health sciences. In second year, they start to look at some aspects of normal communication, the science behind speech pathology, linguistics, and some general psychology and anatomy. In the third year of our program, which is also where people entering the course to do our two-year master's program, if they haven't come up through the undergraduate program, join the undergraduate students, and all of the students then do a problem-based learning year, where they study different components of speech pathology using clinical examples to problem solve in the course of their learning. And they have some introductory clinical experiences as well. In fourth year, our students also have some problem-based learning curriculum studies where they look at the treatment of these disorders in more detail. And at the same time, they're in a wide range of clinical practice areas. They also have a series of seminars looking at advanced issues in speech pathology, and they do those in a couple of block placements as a mini conference basically, so that they get used to presenting in front of each other and they can study an area they'd like to look at in a little bit more detail.
Well, I always knew that I wanted to work with kids and I wanted to help people in some way. And I just moved down from Sydney to Melbourne at the beginning of my first year at uni, and I knew that La Trobe had a really good health science faculty, in particular speech pathology. I really like how we've had so many different opportunities to work with a variety of people. You get to work really closely with the peers in your course, but also spend some time with some really specialist speech pathologists.
Well, originally I started speech pathology because I wanted to work with kids and help them with their speech and language. But as I've gone on throughout the course, I've realised we can do a lot more than that, and so I think it was a great choice. I think my favourite thing is just the amount of placements we get, especially in fourth year. We have here at La Trobe placements that you can actually do on campus as well, so I think that's really handy because this is an environment that we've been really comfortable with over the 3 years, so I think that's a really big advantage of La Trobe. It changes from time to time throughout the course. It's changed. At the moment I'm thinking I'd like to work in a hospital, particularly in the area of swallowing, and for me I know that wasn't something I ever thought I would do, but coming and learning about what we actually do as speech pathologists, I've really found it interesting, so that's where I hope to be.
There's a wide field of choice for our graduates, and we have people coming to recruit from interstate and overseas, as well as locally. The main people who would employ speech pathologists in Victoria would be the Education Department and the Catholic Education Office. The majority of our students would work with children, and generally in an education setting. There are also opportunities for graduates in general hospitals, in specialist rehabilitation centres, in specialist centres like schools that focus on hearing impairment, etc. People work in community health and in private practice a very broad range. Students go in, or graduates go in, to consulting in industry, to looking at enhancing communication, and people will often advise people making films, people looking at putting out literature on language and normative data, etc. So a big range, but more and more students are starting to become more interested in private practice and looking at developing career options for themselves within the opportunities that exist now.